Good afternoon. Welcome to the day 222 at the St. Clair County EMA office, where we try to bring you the most up-to-date, accurate information on the COVID-19. Joined here with Chairman Mark Kern and, of course, the numbers lady, Sam Bierman from the Health Department. Sam?
So numbers not so great again for the second day in a row. So as of today, 107,176 St. Clair County residents have been tested, which is an increase of 674 from yesterday. We are at 8,603 positive test results, which is an increase of 62 from yesterday. And that does include both males and females from under the age of 10 up to their 80s. Today, our daily county positivity rate for St. Clair County is 9.2%. We are at 98,573 negative test results, and unfortunately are reporting 2 additional deaths today, which does bring our total for St. Clair County to 219. Both were males, one in his 60s and one in his 90s. Both had unknown health conditions, and as always, our condolences go out to their families. For those who have completed the IDPH required 10-day isolation period, we are at 7,819. For state totals, 6,950,105 have been tested, with 355,217 positive test results, which is an increase of 4,342 from yesterday. And for deaths, the state is reporting 9,345, which is an increase of 69 from yesterday. Before I move on to hospitalization numbers, we at the Health Department have been receiving several questions regarding the difference between a 7-day isolation period for someone who is positive versus a 14-day isolation period for someone who has been exposed. And the graphic that you guys will see on screen somewhat goes through that, and we're going to walk through that pretty quickly. So as you can see, on day 0, Sally was exposed to COVID-19. On day 5, she got tested, and the results came back negative. Please remember that if you have been exposed to a confirmed positive, you can never test out of a quarantine. You will have to finish your 14 days. But at day 8, thinking that she didn't have COVID, Sally went to a family barbecue. She was contagious on days 8 and 9, which is 48 hours before her symptoms started, and exposed 7 people at that family barbecue. On day 10, Sally became symptomatic and tested positive. So that is why we stress when you are under quarantine how important that is, because now not only has Sally tested positive, she has exposed 17 other people who are now on quarantine and could potentially become positive. So that's just a little explanation. We've been receiving several calls at the Health Department wanting to know the difference between 10 days, 10 days and 14. I apologize. I've got so many numbers running around in my head. 10 days for a positive, 14 for someone who's exposed. We build in those 4 extra days for incubation time and time for symptoms to present themselves. So as you will see, our hospitalization numbers are higher today than what we would like to see. For St. Clair County, we have 54 individuals that are admitted due to COVID-related reasons, and 6 of them are on ventilators. And regionally, we have 111 patients, which is the highest we've been since April 27th, and 13 of those individuals are on ventilators. For congregate living facilities that are previously or currently have been in outbreak status, the numbers that we will announce are any facilities that have had any changes in their cases, and these are cumulative cases. Brightly Senior Living has 11 cases and no deaths, which is an increase of 1 case for that facility. We do still have some testing left this week. Tomorrow, which is October 22nd, Thursday at Clair Fairgrounds from 8 a.m. to 4 p.m. It's under the overhang on the left side of the building. And then on Saturday and Sunday, the 24th and 25th, at Belleville West High School from 8 a.m. to 4 p.m. It is around the back of the school near the tennis courts. And if you have any information or questions on that information, you can find all the specifics on both the St. Clair County Health Department and the EMA Facebook pages. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. We'll go into the zip code report. At this time, these are the changes in St. Clair County zip codes related to COVID-positive individuals. In 62201, we go down 1 today to 273. 62203 goes up 5 to 252. 62204 goes up 1 to 171. 62206 goes up 2 to 518. 62207 goes up 1 person to 266. 62208 goes up 9 to 513. 62220 goes up 1 today to 662. 62221 goes up 3 to 789. 62223 goes up 5 to 532. 62225 goes up 1 to 38. 62226 goes up 7 to 903. 62232 goes up 4 to 229. 62239 goes down 1 to 136. 62240 goes up 1 to 41. 62254 goes up 3 to 288. 62257 goes up 2 to 45. 62258 goes up 2 to 227. 62260 goes up 1 to 166. 62264 goes up 3 to 111. And 62269 goes up 3 to 693. Our county daily positivity today runs at 9.2%. We tested 674 people. 62 of them were COVID positive. That brings our 7-day rolling average up above 7 to 7.1%. Going up, going in the wrong direction. Regional positivity, this is the state's number, and they're pegging us today at 7.6%. That's derived from Bond County coming in at 25.7%. Clinton County, again high at 21.9%. Madison's at 7.7%. Monroe is at 8.9%. Randolph, 13.0%. St. Clair County's at the bottom with 7.4%. And Washington County at 26.5%. So as you listen to this, our zip code, a lot more zip codes, we're having to talk about every day with COVID positives. We see the region around us with the higher numbers. And of course, the regional patients, the highest it's been since April 27th. And so I think today it's fortuitous that we have two guests that are joining us today. Patty Fisher, the president and CEO of HSHS St. Elizabeth's Hospital, and of course Mike McManus, president and CEO of Memorial Hospital, both joining us today to talk about numbers and COVID and giving us an update on their facilities since the last time we were able to have them join us. So welcome, both of you.
Thank you very much.
Thank you very much, Chairman.
Okay, well, I guess we'll start maybe with Patty. Patty, can you talk to us, so regional number 111, 54 COVID-related patients. I think from what we're seeing, St. Elizabeth's actually has more patients than they used to. They're seeing at the hospital. I think your numbers are up a little bit. Tell us about how things are progressing and perhaps why we're seeing this increase in numbers. It's almost like we're back again in April and May.
Well, sure, happy to. And first, I'd like to thank you, Chairman Kern, and also Director Simmons and Sam Bierman for the tireless work that you put in communicating and educating the community. And I think your transparency around the numbers is commendable. And I think, moving forward over the next 8, 9, 10 months, that's what we're going to need. And it's not going away. And it's unfortunately, it's going to be repeating the same things over and over, and really constant vigilance. So at the hospital, our numbers are up a little bit. One of the things that we've learned at the hospital over these months is really we've got more information in terms of treating patients and some more options in terms of being able to not put people on ventilators too soon, making sure that we are proning them when necessary. And we also have medication, the remdesivir, which the physicians do seem to think it is beneficial. So thankfully, it's not quite as scary as it was back in April, May, and our what we call our length of stay is shorter as well. So as we're treating, as we're getting better at treating these patients and taking care of them, we're also getting them out of the hospital sooner, and that's beneficial. But it is very worrisome that the numbers are going up, especially with flu season approaching. So typically during flu season, in the winter months, the hospitals get fairly full anyway. The ICUs get fairly full, and it's not just about how many beds we have. It's also about how many qualified staff we have to take care of these patients. So before COVID, we had a nursing crisis, a nursing shortage, and now during COVID, we are struggling somewhat with nursing and staff too, because a lot of places across the country have been recruiting nurses to come and be what we call travelers. So our current state is we're doing well. We certainly have capacity to take more patients. Our staffing has been fairly stable, but it is really worrisome to think what might happen as we get further along into flu season.
Oh, thank you. Mike, what are you seeing at Memorial?
Well, first of all, I want to stress that I am in my office by myself, so that's why I'm not wearing a mask, and I'm sure Patty is the same way.
Yes, I am.
I trust you.
So, but we're seeing a similar thing. You know, I heard the region since April 27th, and for the St. Louis metro region, you know, writ large too. This is the most patients in a hospital since late August, early September across the whole region. So there's no doubt we're seeing an increase. What Memorial is seeing is similar to Patty. We're seeing an increase, but it's COVID and non-COVID. And since about, I would say August 1, our COVID volume was kind of stayed. It might went up, might went down a little bit, but it pretty much stayed the same. We're seeing a little bit of an uptick now. And it's the non-COVID patients too that are coming in. And when you combine the two, our acuity overall of our patients in our hospital is significantly higher than we've seen in the past. That I think maybe the non-COVID folks have delayed treatment, held off going into a hospital, whatever reason, but they're sick. Our emergency department, we're seeing a higher acuity, even though our overall numbers in our ED are down. The acuity of the people coming to the ED is significantly higher, and that translates into the inpatient census. Between the, we have been pretty tapped out in terms of our capacity for a while now, and it's mainly due to staffing, as Patty indicated. The other thing we're noticing, and I heard your statistics about the rural counties and the positivity rate in the rural counties in the 20s in some counties. We are seeing across the metro region at BJC hospitals and at Memorial more rural transfers coming in that are COVID related, and that is taxing the capacity across the more urban hospitals in terms of our patient care. So that's kind of what we're seeing.
So how do we handle the acuity problem? Is there a message that gets out there to help people? It's really all about testing, isn't it? To be able for people to know they have it, to find out so that they can get it treated?
Well, I could go on and on about testing.
Please do.
Testing has been, I think that our testing as a country has not been where it should be. I think that by and large, counties, states, counties, organizations have been in some respects left to kind of figure it out for themselves because we don't have a nationwide testing strategy, and it is problematic. And you still hear, although the days are coming down, you still hear the anecdotes of I did not get my results for 3, 4, 5 days. In some respects, I'm no clinician, but in some respects, tests are sort of irrelevant if you have to wait that long to get the results back. And so I still believe we need to have expanded testing and more rapid testing. And I do think that some things are coming online that will help that in the near future. We're going to be having an antigen testing coming towards the end of I think the end of November. That'll help in terms of some of the rapid turnaround and things like that. But testing, Mark, is just still problematic.
So anything else? I mean, a message to get out that people should get in to see their physician if they start to feel poorly.
Yeah. And you know, I know I'm preaching to the choir here, but I'm going to go to sort of, I'm going to say my close now, where I was going to save it for the end. It's the big three: wear your mask, good hand washing, and social distancing. We just have to keep drilling and preaching those three concepts. That is the key. That is the key.
So Patty, Mike was talking about the stress that's coming on the system with healthcare workers, and I mean we've been at this for 222 days. You, of course, both of you and your hospitals have been at it, 24 hours a day, 222 days. That is a lot of stress building up. Can you talk about how your doctors, your nurses, every employee, frankly, of your hospital, how they're dealing with all this?
Well, that's a great question. I appreciate it. It is difficult. It is stressful, and we have call a chaplain. So we have a line. If someone wants to call a chaplain, we have a serenity room. But really, I think they rally around their teams most of all. So we go into healthcare because we want to make a difference. And they certainly can see the difference that they're making in people's lives. And in fact, I have a story from that a nurse sent to me that, if we have time, I'd like to read it before we go, just about what they go through with patients who have COVID and with their families. And
Please go ahead with that. Please go ahead with that. That would be interesting.
Okay. All right. Well, I asked some of the nurses who take care of the COVID patients to send me a story that really touched them. And I think, in terms of wearing a mask, you have a lot of dissent out there and a lot of tumultuous activity. And I don't think that really shaming people into wearing masks is going to be effective because that sometimes really does the opposite of what you need. So I think, when you hear stories about how it can make a difference in not only your family, but your neighbors and your community, and that you do it out of a sense of helping people, that perhaps maybe that should be more of a focus. So this is one nurse who took care of this patient. She writes, during the early stages of COVID, we admitted an elderly dementia patient to the unit. The patient was 91 years old and lived at home with her son. Despite her underlying mental condition, she was in exceptional physical shape, clearly loved and cared for. Her son had contracted COVID and subsequently infected her. COVID was much harder on her than her son, but he was still very sick and quarantined at home. The patient rapidly declined, and eventually our support measures were futile. The patient was placed on hospice. And although we made accommodations for end-of-life visitation, the son's COVID symptoms prevented him from being well enough to visit. It was the first time our staff encountered a patient death in which she had to die alone, despite her son's desire to be with her. We worked tirelessly to care for the patient as well as provide emotional support and care to her son, who blamed himself for her illness and circumstances. Often being witness to what should have been private conversations, passing messages of love, apologies, and goodbyes, and being a surrogate child was not easy, but something we were all compelled to do. The son was devastated, and our hearts broke for him. This was one of the first deaths we experienced on the unit, one of the first times we realized the gravity of the new challenges we faced with this virus. While I'm certain we never found the right words to help her son forgive himself, we were able to ensure his mother died with dignity, comfort, and surrounded by love. So I think that's just really an example of what they go through and, what the families go through. So, if you don't care about yourself and to wear a mask, really it's not about you. It's really about your loved ones and your neighbors and your community.
This virus is unlike anything else that we've ever seen. In your hospital, so the stresses on the worker, the nurse that told that story to you that they have to carry this home. Is there counseling available then for your staff when something like this happens? It has to be something that sticks with them forever.
Yeah, absolutely. We call it Employee Assistance Program. And so we offer a kind of a variety of counseling options, phone, telehealth, or even in-person counseling too. And I think, it's really, it not only takes a toll on the employees, but, in the public in general. I had a lunch with a friend who's a nurse at Barnes and works on the transplant unit. And he told me that the number of transplants have increased during this period of time, which I kind of thought was a little puzzling. But I asked him why, and he said because of the number of suicides that have increased because of behavioral health issues. And so, you have more donors after a suicide. So it's kind of like a gut punch, really.
Mike, I assume you're seeing a lot of similar things at Memorial.
Yes, and similar stresses on the staff, as Patty mentioned, and we try and support them as much as possible in similar ways. And I kind of go back to earlier in this whole pandemic. Community was super outpouring of support, food, donation, mask items, and healthcare heroes, and a lot of great community support. And I think I agree with Patty 100%. Shaming people into wearing a mask will not work. And perhaps the best way community can show their support of our healthcare workers is by wearing a mask and showing that we are in this together. We are trying to work to support our neighbors. We're taking care of neighbors and things like that, and doing those things because it is stressful after 7 months of this for staff. They're ready to tap out, and just kind of keeping that going. I do want to kind of change a little bit and do a look forward. I think we are all in healthcare worried about the winter and how it's coming. We are preparing for resurgence planning. We are looking at, with the flu, with COVID, with staffing issues. I think we potentially could have a very rough winter ahead of us, and we have to be prepared that, heaven forbid, there could be another reduction in elective procedures and elective services if this continues to go because we're basically coming into a third peak now. We're heading into a third peak, and we have to be prepared again for this. And we haven't been really through this in a winter month yet because this really started in mid-March. So this is going to be new territory.
And so then that goes along with that goes the economic stresses that occur on both of your hospitals. How financially this has to be a pretty devastating year fiscally for your hospital, Mike, and I would assume St. Elizabeth's also.
It's been an odd year. I would say it that way. It was. I will say that some of the federal CARES Act money helped quite a bit. I think there's still an open question, and I don't want to get into the details on that about how much of that stays or goes back to the federal government and things like that. Remains to be seen. April, May, June were very challenging months. CARES Act helped relieve it. We had PPE costs that went up again, things like that. We had to react with expense reduction, unfortunately. That included furloughs and things like that. Many hospitals had to do that. And so we've sort of been on a roller coaster, Mark, in terms of finances. It's really been a very odd year. and we've had to cut back on capital expenditures. So investments in our community, equipment, things like that have been deferred. So I'm not kind of ducking the question, but I think it still remains to be seen how 2020 is going to really play out from a financial perspective. It's not going to be pretty, though.
So Patty, I think we talked a little earlier about some testing. Can you talk a little bit about testing that goes on at St. Elizabeth's?
Sure. I would wholeheartedly agree with Mike, though, that the testing strategy nationally needs some assistance, and that we would definitely benefit from having additional testing. At St. Elizabeth's, we do have some in-house testing, but it's limited, and we have run out of what we call reagents on occasion, outside lab, which is called Quest, to do our testing when necessary, but that is an average of a 30-hour turnaround time. So that is, that makes it really difficult, because if you have a patient who you suspect has COVID, you're going to put them in isolation, you're going to use all the PPE, your nurses can't take care of as many patients. It really utilizes a lot of resources. So we've actually, Senator Durbin, we've been on calls with him. He's really pushed, I think, for increased testing, and then the director, Ngozi Ezike, she's really worked as well on that front. The HSHS Med Group does have a drive-up testing site at the Urgent Care site off of Green Mounts, right across from the hospital. And I think the director has information that he can share on the website too. You just have to register online to get that. So that's kind of the status of our testing. But we do need more tests. We need better contact tracing. I know that the health department is doing a good job and doing the best they can, but it's a difficult thing to do with people with cell phones and just trying to reach people. So it's multifactorial, I have to say.
Mike,
No
anything?
easy.
It is. Mike, anything to add on testing?
No. We both have kind of drive-up collection sites, which I think is beneficial. Patty mentioned there's Memorial. We do that too, and the challenge is you need to test folks who may be symptomatic or have symptoms or whatever, but you also have your procedural testing that we have to do with regard to the hospital side. And teeing that all up, the state requires testing 72 hours in advance, things like that. Getting that all coordinated so that the patient experience, because the patient experience changed when you come in a hospital these days, and getting all that teed up and coordinated and getting the test done so that everyone knows we can proceed has been a logistical challenge too. And just the lack of reagents, as Patty talked about, we have experienced the exact same thing. And it's very disappointing from the lab companies in terms of the supply.
Well, I know one thing that isn't disappointing. We're proud that we've got the A team, Patty Fisher and Mike McManus here in St. Clair County, taking care of us with our hospitals. Herb, what did I forget?
You didn't forget anything. I just want to say to Patty and Mike, I know I've had you on speed dial, both of you, and we really appreciate those calls, whether it be during the day, during the evening time. You have both really helped us out, providing physicians that have came on these briefings and have helped ease the questions of our followers of Team St. Clair. And St. Clair County is really fortunate to have two people like you running these medical facilities.
And we got to get a flu shot, right?
Oh yeah, that's what I was supposed to say too. Flu shots.
I got mine last week.
I'm shocked that Mike forgot to say that.
I got mine. So, Herb, I appreciate those kind words, and we are truly all in this together.
Well,
yes, we are.
I remember a few months back, I got a call from Mike on a Friday evening, and when I get a late night call, it's usually a panic call, and so I answered him right away.
Thank you both for working so hard and being a part of Team St. Clair.
Thank you.
Thank
Thank
for
you
having
very
us.
much.
Thank you.
Yep.
Well, there you have Patty Fisher and Mike McManus, as the chairman said, good dialogue there of what the hospitals bring to the plate. And as I said, St. Clair County, we're really fortunate. The entire region is fortunate to have those facilities along with Touche Regional Hospital. And we'll get them on here also. 7.6, up from 7.4 yesterday. As you said, we got to go. This is not about getting the most points. We want to get the least amount of points. So we got to work on that. Before we go, I just want to remind you, 2 more deaths today, 219 deaths in St. Clair County. We talk about that. 1 is too many. But the number that also I think you want to look at across the country, 221,000 deaths. And for those people that are out there that, there's some of them on here today, it's fake, it's this, it's that. Okay, no problem. But for Team St. Clair, you members out there, continue to do what has to be done. Wear the mask, wash the hands, practice the social distancing. You heard Patty and Mike and the chairman and Sam and everybody. It's the best defense we have until there's a vaccine that comes out. So together, Team St. Clair, we can do this. We have to keep these numbers down. We don't want to go back to 8, because if we do, then we start all over again. So we're going to be back here momentarily with Cindy and Daisy to translate this into our Spanish communities, and then we'll be back tomorrow with you with hopefully some good numbers. Everybody have a good evening.
Mask, gloves, soap, scrubs, TikTok, Grub, Hub, Twinks, Jocks, Bears, Cubs. Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
No school, gym closed. Don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish. Don't come close. Just wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet babes?
Gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on, stay inside and lock the door. Stay